Right, I think we'll get started. So our agenda for today, we normally do welcome and introductions in this group on screen, but there's quite a lot of us this evening and we've quite a lot to get through as well, so we might have to skip that part, but if everyone would like to introduce themselves in the chat box, that would be brilliant, thank you. We're going to go through an overview of the key messages this week. I'll go through who are the champions and their role. I think we have a few new champions joining us this evening, just to give an overview. As always, we have Champions Corner. So any questions you have or anything you'd like to raise, that's the perfect opportunity. But as always, please do use the chat box function. As I mentioned, our theme this evening is the vaccination programme, and we have Dr. Vasa and Kieran here this evening to talk us through that. And we'll have time for questions as well and a discussion. I'll go through next steps as usual, and we'll finish by 8 o'clock. So welcome any new champions joining us this evening. Apologies if you were here last week, I wasn't, so I see a few new faces or names in the meeting list. Please do use the chat box function and introduce yourself. And as always, housekeeping, you can have your camera on or off, whichever you prefer, but we just ask that you mute your microphone when you're not speaking to prevent any feedback. So our key messages this week, the 7-day rate in Merton has increased. We've seen an overall increase from 860.6 to 1020.5. And we've also seen an increase in the over 60 7-day rate as well, from 483 to 816. And this increase affects all of Merton, both east and west, and all age groups. You hear me say it every week, but hands, face, space is a key component in reducing the transmission of the virus, and not forgetting the importance of ventilation as well when indoors. I'm sure you've heard this all already, but the NHS is under significant pressure, with a major incident being declared in London. To protect the NHS, it's so important that we follow the national lockdown measures and stay at home. We're seeing a number of outbreaks in key settings such as care homes. Again, to protect the most vulnerable, we must follow the guidance, stay at home, protect the NHS, protect our loved ones. This one's really important. If anyone has any symptoms, however mild, it's imperative to get a test and isolate immediately. You can call 119 or you can use the link on the screen, but do not attend an asymptomatic test site if you do have symptoms. The asymptomatic testing programme, which I just mentioned, has been launched in Merton. Residents without symptoms can get a test at Morden Assembly Hall. Frontline workers, VCS staff, volunteers and carers can also get an asymptomatic test at community pharmacies, and we encourage all frontline workers to get tested twice a week. All tests have to be booked online, so we don't have any walk-ins, and the link is on the screen here for booking your asymptomatic test. So that's really important, and I'll share all of this with you as usual on Friday, so you'll have all the links. And the final point of our key messages this evening, and the theme of our workshop as well, is on vaccinations. So the rollout is increasing, and we have about 6,000 people in Merton vaccinated so far. Kieran and Vasa will provide more information in a little while, but it's important to not attend a GP surgery or contact your GP. You will be invited for your vaccination when it's your turn, and this is in line with the prioritisation that's directed from the JCVI. So the COVID-19 Community Champions, who are they and what do they do? Our champions, anyone who lives or works in Merton can be a COVID-19 community champion. if you wish to spread the key messages from the NHS and public health. We have 130 champions, so thank you very much everyone for spreading the word and signposting people to us. We have a really broad representation. We have residents, councillors, service providers, officers from the council and the CCG, VCS reps and clinicians. Thank you everyone who has helped spread the word about the network, but also continuing to share the key messages weekly and spreading those messages further than just the network itself. Three-step approach. The first step is to receive key messages during our drop-in sessions on a Wednesday, either the afternoon or the evening session, through our weekly email on a Friday, and also in the WhatsApp group. The second step is we ask you to spread the word. So share these key messages with friends, family, colleagues, communities, networks in the most appropriate way to you. That can be verbally, via email, forwarding messages, WhatsApp text messages, or sharing on social media. And the third step is feeding back to us. So what's working well, what isn't, what are the issues in your communities, and also asking any questions you may have. What the COVID-19 champions do not do. So our champions are not public health specialists or COVID-19 experts, and we don't expect you to be able to answer every question that you're asked. You can always ask us using the email addresses on the screen. I think most of you have my email. If not, it's there. Please use it if you have any questions. You can also ask questions in the chat box function at any point during the drop-in sessions, in Champions Corner, and in the WhatsApp group as well. We'll do our best to get back to you as quickly as possible so you can get back to the person who's asked you the question. Yeah. So now we're at Champions Corner. Does anyone have any questions or any points they'd like to raise? Any questions about vaccinations we'll answer after the workshop theme, but any other questions people may have or any comments? You're all very quiet this evening.
I would have one. Can you hear me?
Yeah, we can hear you.
Hi, Adrian. Hi there. I'm not sure if that has to do something with vaccination, but a lot of my constituents are very concerned about the question of one jab or two jabs. So what is with the postponement of the second jab, and they feel very insecure. What does it mean actually?
Yeah, we'll get to that after the workshop theme on vaccinations, and we can discuss that there. But that's a really good question. Thank you, Adrian. I have an update for everyone as well on our COVID marshals. I wasn't at the evening session last week, so I'm not sure who raised it, but I have an overall update. So the COVID marshals attended the Sainsbury's in Collier's Wood, and they found that the necessary COVID measures were visible and in place. The one-way system was an area of concern as it intersects with the M&S entrance and exit and the shopping centre lifts. So the COVID marshals have advised a member of staff be placed outside this intersection during busy periods to encourage people to use the one-way system. When the store reaches capacity, the queue is organised from the back and people can only enter when the number inside decreases. The COVID marshals also attended the Morrisons in Mitcham, and they did not find any school-aged children hanging around, but they will continue to patrol this area on a regular basis. The Sainsbury's in Morden was also visited, and they had the necessary COVID measures in place as well. They also had a member of staff at the entry and exit doors, and they're monitoring the number of people entering and exiting the store. And the Morrisons in Wimbledon and Korea Food in New Malden were also visited, and also both had good systems in place. So just an update for anyone. And also, if you do have any concerns about any premises in Merton, please do get in touch with us or Maria Dane, who often joins the meetings. And you can contact us via email and let us know, and we'll signpost the COVID marshals.
Sorry, I do have a question there, Una, because I've witnessed before Christmas, and I think the damage has been done, that the Sainsbury's used to have a really good system at the Saver Centre for queuing people and, you know, bringing in people spaced out. They then stopped that just before Christmas, and it was a free-for-all. And I'm not being funny. I was horrified, and I was doing some volunteering down this. I watched row upon row, which would not have happened earlier in this pandemic, and I thought it was very bad timing for it to have happened, actually. So I do want to say that they may not have found anything because the volume isn't there, but I think they need to be warned that at peak times, when there is another event such as Christmas, they are not doing their duty anymore. They stopped. They simply went for money. I was quite horrified at what I saw, and I don't know, there may be some other people on here who witnessed the same thing, but it was quite distressing because there were no queues. There was no stopping anybody coming in at all, and you can imagine how busy it was.
Okay, thank you, Karen. I'll feed that back to Maria as well, and she can feed it to the COVID marshals to make sure that they're still complying and that they're aware of the measures that need to be in place. Thank you for that. Now, does anyone have any other questions? Bernie, I see your hand is up. You're on mute, Bernie.
Someone had to say it. Okay, thanks. Okay, well, it was, before I leave, it's something quite positive to say, I hope. I raised last week, or the week that you weren't there, Una, about the parks and how it was just taped up. And Barry said he'd take it to the parks, and I just wanted to say that actually there's been fencing put around where the outside gym is, so it can't be used. So just to feedback, you know, thank you, and that's really good, really. So you know, no one can use it unless they climb over the fence, and I mean, it'd be a bit uncomfortable to do so, I'm sure, for anybody. Anyway, but thank you very much, and I will leave now, but thank you, and everyone, the rest is really good too. See you later. It's just I saw it earlier, that's all. Okay, all right, bye.
Thanks. Bye.
Bye.
Leoka, I see your hand is up.
Yes, I just wanted to comment on Karen's comment about the Sainsbury's. Every time I've been to Sainsbury's in Colliers Wood, not had a problem. There's always a queue of people round the back. The only concern that I would have there is obviously there isn't anyone to marshal the social distancing between people. Just like you find wherever you go, people just tend to be like sheep, and they just go and stand behind someone else until somebody turns around, gets offended and says back off, kind of thing. But I haven't had a problem in any of the stores that I've been in.
I do think they have a very good system in place. They did not use it at Christmas, and it may have come back. I haven't been much since, and I have a lot of respect for what the supermarkets are doing. I would like to say that I think they're in a very delicate, dangerous situation themselves, their staff. So I really appreciate the work. But there were times at Christmas there was nobody, as you said, marshalling, but nobody saying, because they had a number they were working around. That number then doubled in the summer. It went from about 200 to about 400. I don't know what the number was at Christmas, because people were just coming in continuous streams. That's my point, Yoka. And you're bang on. There was no marshalling because they weren't queuing people the way they used to.
No, but on another front, I see that Tesco's are introducing a traffic light system now. So they're having a green and a red. So they're literally now starting to count the amount of people that go into their stores and stop. So I think since Boris has announced about no queuing, I think everybody's now on the bandwagon to tighten up what was happening. So yeah, I've heard quite a lot of them now. I've had lots of emails from the chief execs and people, as with everyone else would have had, to say what changes they're making, what they're introducing. So hopefully we'll find it even better than it was last time.
Thank you both for that feedback. And yeah, I will share that with Maria as well about the social distancing in queues, and we'll inform the COVID marshals. So thank you both.
That's okay.
Kemi, you put your hand up.
Yeah, sorry, I was just going to remark. Can you hear me? All right, yeah.
Yeah.
About the, the click and collect. If it's okay where you have, when you have.
Sorry, Kemi, it's quite difficult to hear you.
All right. Raise the volume. No, I was just saying about click and collect. That is an issue sometimes. With click and collect, you don't have anyone monitoring outside the stores, so sometimes that can be an issue.
Okay.
Yeah. So click and collect stores where people do queue up, and sometimes.
Thanks for that, Kemi. I'll feed that back as well. That's really helpful, everyone. Thank you all. Do we have any other questions before we move on, or comments? No? Okay, in that case, we are at our workshop theme this evening on the vaccination programme, and I'm going to hand you over to Kieran, who's going to take you through the presentation, and then we'll have time for questions and answers with Dr. Vasa as well.
Thanks, Una. Are you putting the presentation up?
Yeah, I have it here. Can you see that?
Yep, it's coming. Maybe. Cool, thank you. So I'm Kieran, I'm a pharmacy technician and I work within the CCG, and my main role is usually supporting care homes, but also at this time I'm trying to do other things and help out a bit. Can I have the next slide, please? So obviously we're doing this because there's been a lot of detail in the media about the COVID vaccine and how the UK are trying to get it out there. So this presentation is going to go through some of the key messages and try and answer some of the questions that might have come up around the vaccine. And then obviously at the end we'll have an opportunity to ask any questions and hopefully we can answer. And we've got Dr. Vasa here as well, who's a lot more knowledgeable than I will be, but I'll try my best. Next slide, please. So the three key messages is basically what we've been trying to get out all along. It's also trying to keep yourself safe, as well. Obviously the hands-face space, and the main thing being that the vaccine is safe and effective when it gets granted to your turn. And the NHS will let you know when it is your turn to have the vaccine. So it's important to not contact a GP practice before then. Also, if everyone starts phoning their GP, they're going to be completely overwhelmed. So the GP practice will phone you and get in touch when it is your turn to have the vaccine. Next slide, please. So within the UK at the minute, there are 2 vaccines that are currently being used, 3 which have been approved. So we have the Pfizer BioNTech and the Oxford AstraZeneca, which are currently being used. And both have been shown to be safe, and the MHRA have given approval for them. We've also recently had the Moderna vaccine, which has been approved, and I believe we're expecting doses of that to start in the springtime. But in principle, the government have lots of these vaccines on order. And as you see there's 40 million doses of BioNTech and Pfizer, 100 million doses of the Oxford AstraZeneca, and then around the 7 million doses of the Moderna. And further to what this says, the Moderna has actually been approved now. Next slide, please. So why are we using a vaccine? So vaccines are crucial part of the defense against their infectious diseases. Also, we all know that we get lots of vaccines for lots of different things, from babies right the way up to adults. So when you do get a vaccine, it's harder for disease to spread to those who can't have the vaccines. And then obviously getting vaccinated not only protects yourself, your family and friends, it protects your community. And the vaccines are obviously made to prevent people from getting serious infectious diseases. And it's much safer for your immune system to learn to fight an illness through the vaccine than it is for if you get the illness and have to try and get yourself better from it. So there's lots of messages going out. Some of the little pictures here show messages that are being sent out by the NHS through social media to try and get that message out sort of far and wide, so everyone's aware of what the key points are. Next slide, please. So who's going to get the vaccine and when? So there's an independent group of experts, the JCVI, and they've obviously put together a list of who is the most at risk, and so who should get the vaccine first. So the top priority was people in a care home, so people in a care home for older people and the staff who work within the care homes, alongside the 80 plus age range. And then obviously below this cohort is all the different ages and those who are vulnerable. So at the minute they're working through the top ones, so the care homes and the people over 80. And when it is the right time for you to get your vaccine, you will receive an invitation. So it could be phone, GP, through the national booking system, a letter, it might even be a text message. Also, lots of people are eager to get vaccinated, but it's important that you do get vaccinated at the right time so that people who are most at risk obviously get the vaccine first. Next slide, please. So like I've just said, the people aged over 80 or who already have an hospital appointment, people who work in care homes and healthcare workers at highest risk. So this mentions about being offered in hospitals. There are obviously now local vaccination centres as well, and you'll probably have seen in the media this week that there's been some national mass vaccination sites set up across the country. So like it just says there, just what I've said several times, but don't contact your GP. The NHS will let you know when it is your turn. Next slide, please. So obviously, why do you have to wait? A lot of people get anxious. Why do I have to wait? Why can't I just get it now? It takes time for it to be manufactured. It takes time for it to be approved by the regulatory authorities. And obviously, like we said, it's important that every dose is used to protect those at highest risk first. So some people who are housebound and live in a care home, they can't get to the local vaccination centres. So since this presentation was put together, the AstraZeneca vaccine is now in place. It is much more able to be moved around, and it is currently, as we speak, being used in care homes within Merton this week. So we're really getting out there and really getting the most vulnerable people vaccinated as we speak. And I believe housebound people are due to be getting vaccines imminently. Next slide, please. So the vaccine will be administered at the local vaccination sites, which are run by your local GPs. There are some hospital hubs, and there are now mass vaccination centres as well. I think the nearest ones for us are the Excel Centre and Epsom Racecourse. But over the coming weeks, there'll be more capacity being built within the systems, so there'll be more and more vaccines getting rolled out quicker, hopefully. Next slide, please. So what if the centre I'm offered is not easy to get to? So obviously you will be contacted, and if it's not a centre you can get to, there might be a site that you can get to that's more convenient, or it might be, if you can't get to, say, a hospital site, you can get to a more local site, or you might be able to get to one of the mass vaccination centres. But that's something that can be dealt with when you are offered the appointment, when it is your turn. Next, please. So the vaccine is only available in the NHS. It's being rolled out, so it's fair. Like the NHS, it's free. So it's important that people can't skip the queue and jump because they've got money and jump ahead. And there's no plans for it to be mandatory or compulsory, but obviously we'd hope that more people want to get out there and get the vaccine to protect themselves, their families and their communities. Next slide, please. So, as we said, there are a few different vaccines, but it's not necessarily that you can choose what vaccine you can get. There might be different, as we've seen, there are different quantities of the vaccines being produced and which have been purchased, so it will depend what is being used at the site, but everyone will be assessed as to whether they meet the criteria for that vaccine. So if there are any concerns, that will be picked up before you receive it. So you can always be assured that whatever vaccine you're getting, they all work the same, they all provide efficacy, so it will give you that protection from coronavirus. Next slide, please. So is the COVID-19 vaccine suitable for me? The vaccine itself contains no animal, so it's suitable for everyone to have the vaccine. And all ingredients which are within the vaccine can be found on the government's websites. So if you do have any allergies to any specific items or have had reactions to vaccines in the past, you can make that known. But as I say, there is no animal or fetal origins within the vaccines. Next slide, please. So yes, the vaccines are safe. If they weren't safe, the MHRA would not have given the go-ahead for them to be used. They have to undergo very strict processes to make sure they are safe, and they have full confidence in the processes to make sure they are safe. They do offer a high level of protection, and as with any medicines, they are highly regulated. There are checks throughout the whole process, development, manufacturing, and then they continue to monitor once it's authorised and being used within the wider population. Next slide, please. So if you're of childbearing age, you're pregnant or breastfeeding, there's been some recent guidance to say that pregnant women and those who are breastfeeding can have the vaccine, but you should discuss it with the clinician at the time to ensure that the benefits outweigh any potential risks. And it's a good opportunity to obviously see what concerns you might have, and for that clinician at the time to give you the most up-to-date information. The information is constantly changing. There's new information coming out almost on a daily basis as we begin to know more about the vaccines and how it affects people. So it's always important. Any concerns you can always raise at that time when you're going to get the vaccine. Next slide, please. So does the vaccine have any side effects? So like all medicines, there are potential side effects, and it's important details that obviously they're always considered as part of the safety process. So for these particular vaccines, like most of the others, some people might feel slightly unwell. There's report that no significant side effects have been observed in tens of thousands of people within the trials. All patients will be provided with information when you do have the vaccine as to what side effects might occur, and you can find them on the website. But some of the most common side effects that I've heard about have been, obviously, you might get a sore arm, like any vaccine, like the flu vaccine. You might get a bit of a headache, and even just aches and pains, which you can take paracetamol for, and they should all wear off within a day or two. So it's nothing too major. Next slide, please. So how effective is the vaccine? So the MHRA have said that they're highly effective, but to get full protection, people have to come back for the second dose. And that's really important. And it's just like the rabbi mentioned a little while ago. Yes, the guidance did change to be from 4 weeks to 12 weeks, but this is part of the process to make sure that people can get vaccinated as quickly as possible. And also there's been a lot of research done to make sure that it is appropriate and it's not going to cause any problems with the efficacy. And you do start to get protection around a week or two after the full protection after the second dose. So that's why it's important you do get that second dose. But when you have the first dose, you will be booked in for the second one. And as we said, it is now up to 12 weeks apart. Next slide, please. So what happens if you have the first one and not the second? So both vaccines are authorised on the basis of 2 doses, because from the trial data, it shows that that gives a maximum level of protection. So to ensure as many people are being vaccinated as quickly as possible, the Department of Health and Social Care have advised that the second dose of both vaccines now be scheduled up to 12 weeks apart. But the evidence doesn't show that any risk of not having the second dose other than being as protected as you otherwise would have been. But we would urge everyone to show up for both appointments to protect yourself, and also make sure that no vaccines are wasted or NHS time, which obviously is very precious at the minute, as I'm sure everyone's well aware of in the media. Next slide, please. Oh, and then if anyone has any questions.
Thank you, Kieran. That was really helpful. Adrian, if you want to ask your question again, Dr. Vasa or Kieran will be able to provide an answer for you.
So first of all, thank you, because I think that helped quite a lot. The concern was that people are even not getting the second vaccination, or what happens is, so I heard something that the AZ jab is only 70% in its way how it helps to protect the people with only 1 jab. So the question is, why then the extension? Why not doing it earlier? Is it not better to vaccinate and to go to the nearly 100% as quick as possible for those who are most vulnerable, and then step by step to extend? And is it not easier to shield people who are not vaccinated than having people who are semi safe?
Thank you, Adrian. And that is one of the most commonest questions I get asked at work by people who work in my practice, by other clinicians, and of course my patients. And I think that question will always be asked, because if we lived in the ideal world, which all of us know we don't, but if we lived in the ideal world, yes, on day 21, that is 3 weeks after the Pfizer product, you'll be called for your second dose. But so therefore we had to ask the question, okay, why? What are we doing and why are we doing? So I think the why is obvious. We see in front of us hospitals completely overwhelmed with the work, staff at breaking point, and we keep saying staff are at breaking point. Does the camel's back need to break before we see camels on the ground? And I'm not calling our health service staff camels at all. But I think we need to know that we don't want to wait for the final straw which broke the camel's back, because when we come into recovery, we want a system which is working, but a system is not bricks and mortar. System is the people who work in it. And I'm not exaggerating or overstating the case that we are bound to protect both the system and the people who work in it. Then we had asked the question, what is going on at the moment? We are being overwhelmed with number of people who are falling ill, and those who are falling very ill are actually falling very ill. And therefore we had asked the question, what can we do? So our ethical principle then has to be to achieve the greatest good for the greatest number. So that is one of the fundamental medical principles we follow in any resource limited environment. So based on that, if you go back to the science tells us that if you do group 1 to 4, we will reduce our mortality by 60%. So we can reduce our death by more than half. If you do 1 to 9, we go up to 80% reduction in mortality or hospital admissions, if you do 1 to 9. So therefore we come to the conclusion, purely not by politics, but purely by medical ethics and clinical reasoning. I really need to stress this. This is not a political decision. This is medical ethics and clinical reasoning. Those are the 2 pillars I am willing to stand on. On those pillars, we can safely conclude that we will achieve the greatest good if we try and get most people 1, rather than giving half the number 2. It's a mathematical situation we are faced with. Now, once we get over the current cliff edge, then we have breathing space. Then we can see what we can do. Our supply will improve, We are moving on from Pfizer, which is a very good product. I don't want to say anything bad about it because Pfizer did a good job getting us off the mark, to the Oxford version, which is more transportable. And once we get into that, we will get the momentum. And I am confident as a clinician that we can get to the group, the first 4 cohorts, pretty quickly. And then when we get breathing space, I am hopeful to be in a position to call people back well before the 12th week. I can't make a promise which I can't keep, but our intention is to try and get to the second dose much less than 12 weeks. But we can't do that because, for me, every first vaccine given is proportional to every life which could be saved. And I think it's purely because life is sacred. And I think, therefore, we are duty bound as clinicians to say, do one to most number of people. I know I'm making an emotive argument, but if I am without emotion, I won't do this job.
Thank you, Adrian and Vasa. That was a really good question and a great answer. Thank you both. Karen, I see you've a couple of questions in the chat box. Do you want to ask them?
Yeah, I would. I'd like to start by saying I'm actually working at both of the hubs as a volunteer for the Wilson and the Nelson, and I've done that right from the word go, effectively. So the questions I'm asking don't come from anywhere, they come from observation. I'm going to work backwards through them, actually. Just the point that was made, because I think this is the wrong message to send out, and it's quite important we get this correct. People are not being given second appointments at the hub. As volunteers, we're being asked to give, they come to us and they say, do you have our second appointment? We go, no, we don't know. So that is a key point. When I first started vaccinating, I actually went into a GP's practice, and a lot of us, and there are still people in GP's practices, calling up people and making first and second appointments. Once this change in guidance appeared about vaccinating everybody with the first dose, the second appointments have not been given. So I would like to come back to that, because there is a concern I have. We have data on who it protects, but I'd like to know the data of how valid the vaccine is after 12 weeks. There is no, and that's a very important point. We need, because if we go beyond 12 weeks, we could be undoing all the hard work we've done. And I think without data, you can't trade off, in my opinion, in that manner. Although I do agree with vaccinating as many people as possible for the first dose.
Currently, there is no plan to go beyond 12 weeks. The intent is to vaccinate within 12 weeks.
Brilliant. So my second question is, because this is the bit that I couldn't figure out, if we're giving it to everybody in as quickly as we can, are we making sure somewhere that we have enough doses of the vaccine each person is given, particularly the ones we've bought in lower quantities like Pfizer? So I was sort of wondering, well, what happens if those doses run out and that's all we've bought? And Pfizer can't supply the world at the moment as it is. I'm not sure we'll be able to go back immediately and just get more. So that's our stocks assured for the second vaccine. And so at what point will I think there's an organisation programme that I don't feel is present at the moment for the second vaccine, which does need to be considered. So I'm sorry, because I think you're doing a great job. I do want to say this. People need to realise the level of work, the level of commitment, how fantastic the NHS is, and all the people working there. So I'm not knocking this, Doctor, because I think they're doing an amazing job. And I don't necessarily disagree with the priorities, but I don't want to see all these wonderful 80 and 90-year-olds with tears in their eyes, some of them, it's making me emotional, miss out on their second dose. It would upset me quite dramatically.
I think you do make a valid point there, and I think I need, because I'm not part of the procurement supply arm of the system, I need to write it down and then seek some guidance from somebody else to say, are we certain that what we originally planned to get in 3 weeks, in day 21, now how are you going to manage the stock of that down the road, say probably 2 months, 8 weeks, or hopefully between 8 and 12 weeks? Because I think the next 8 weeks, we have to make sure that we get the maximum number of the British population in those cohorts done.
Absolutely. And can I ask a question?
Yes.
So as a GP, I have been telling people to contact their GP regarding the second dose, because I'm not a clinician, and things are moving at such a pace. I can't go back to the people who've registered them. They don't know either. So what would your guidance be? What would you suggest we say?
I know.
I did say give him a few weeks. I did say.
I don't blame you. I don't blame you. And I think that's what's going to happen. How much I tell people, don't call me, because I don't have any answers at the moment about when you're going to be called for your second dose. All I know is there is a promise that we will call you for your second dose, but don't know when, don't know where.
Can I say to them then, leave it for 5 or 6 weeks?
I think so. I think let's be realistic.
That's what I've been saying, because I thought that was a reasonable.
Yeah, we need to get some breathing space, and then hopefully then we'll be able to work this out. With more and more centers opening, and therefore, see, we don't need to Pfizer product which we originally used. We can do the mass vaccination in the mass centers and use the Oxford one to reach out to more people. I think then we'll be in a much more comfortable place as a country where we can then take stock and see, okay, how are we going to do the second lot, the second dose?
But I do think figures need to be looked at before.
Yes, oh, definitely. I think on the procurement side, somebody has to keep an eye on it and make sure that we do honor the commitment, because I know I know I'm going to be held to it.
The second thing is, I did want to raise a point. The Pfizer vaccine is not being given, as far as I'm aware, to people with allergies requiring an EpiPen, and even there are issues. So just so that people don't just turn up.
So that was the case initially, but this
word changed.
The word allergy is one of in my near 30 years of clinical practice. The word allergy is one of the most abused words known to mankind, and it's been used so loosely, and I even cringe at this word, because that makes people ineligible by saying I'm allergic to something when what they were originally was intolerance. But now it's about anaphylaxis, not allergy, anaphylaxis to an ingredient.
So I did a sheet in and I would need to know if this guidance has changed, because sometimes people turn up and are quite worried.
Yeah.
When they, and we don't know that things have changed. Are people allowed to have the vaccine, the Pfizer vaccine, if they have an intolerance or an allergy? Or
intolerance is permitted. Nothing is prohibited on the basis of intolerance. Anaphylaxis is the word we will use medically, and therefore we'll explain what that is. And if you're anaphylaxis to many drugs, then you may opt out of Pfizer and go on to the Oxford version.
So it's not the EpiPen anymore that's deciding it.
Again, EpiPen, it also has been given to people who haven't had anaphylaxis before. So we are unable to use the word allergy or EpiPen as a proxy to determine eligibility or prohibition. So that is why, in a way, the Oxford product gives us more breathing space on this topic. But please do not believe just because you're EpiPen, because you're allergic to penicillin, that you can't have this, because
that's when people have been sent away because of an allergy to penicillin. And has that changed as well? These are all, I think everybody needs to know this, really.
Because there is no ingredient. Penicillin is not an ingredient in the agent, you see.
So it's okay if they have an allergy?
We're very careful to use the word okay and allergy. As I said, I determine what anaphylaxis is. If I am the jabber, if you don't mind me calling myself the jabber or the vaccinator, I clarify what do you mean by this allergy. If I'm booking somebody in, I look through the case notes, and it may be a rash or a diarrhea. It ain't an allergy. That's an intolerance or a side effect. So, but I think we are moving away from that. When Pfizer, and then there is unnecessary attention on the feint, and then the whole vaccine project gets off to a bad start. Confidence drops. So we were very strict to begin with, but now we know. Now we know that we can be much more practical about this and not make people ineligible because we were loose with medical terminology.
Good. That's really good. That's good to
know. Karen, can I say, our aim now is not to look for a prohibition, but to look for a prohibition. So our fundamental aim now is to say, how can I get this person vaccinated, rather than me saying, how can I fish out a reason to say no visa for you? Yeah, and I think we really, as clinicians, our mindset is very programmed. Try and permit a vaccine rather than try and prohibit one.
Brilliant. That's brilliant. Can I just ask, and I'm taking a bit of time here, I'm going to mention this and drop it, and then somebody can deal with it afterwards. There are whole families turning up at the hub with, so you've got the grandmother, the mother, and then you've got the kids and everybody is trying to get the vaccine, and a couple, I think, have slipped through. But there needs to be a lot of messaging, and I think that needs to come from public health, from GPs. because it's becoming a little bit unfair when that happens. I have actually not been able to book in people who weren't a certain age in the beginning because they didn't meet the criteria at that moment, and they were like caring for their 85-year-old partner and they were like 78 or something and underlying. So I'm seeing 20-year-olds get it as well, not NHS. NHS absolutely fine. I think there needs to be some stronger messaging to stop people coming to the hub, and actually it to be quite clear that they could be treated quite rudely. I don't mean that nastily, because I think at the moment we're all trying to be too nice at the hub about this, but this is growing, it's not getting any less. So sorry I've taken up so much time. Thank you, Doctor.
It's all good questions. The more good questions I answer, more happy I am, because what I need to is to make the champions empowered to deal with these issues at community level. So really, really important. Please carry on.
Thank you, Karen. That all those questions were really, really good, really useful, really informative. Thank you, Vasa. And also we will be pulling together all the questions asked and responses and share them with you, so you can also share them. We'll be putting them on the webpage. So all of these will be available to you as well to share. And that will help with the messaging, Karen. And we're also working on that as well from a public health perspective. Our communications team are working on that quite hard at the moment in terms of messaging around the vaccine. I've just seen a few questions in the chat box that I want to get to before we run out of time.
Una, sorry, I've had my hand up for quite a while. Sorry, it's Beck here from Herefordshire Merton. It's
sorry,
just a quick...
Beck, I haven't seen that.
Yeah, sorry, I've had it up for quite... Sorry,
I've also got my hand up.
Yeah, there's a couple of people with their hands up. I think there I can just see it was myself and Asha. So
yeah, that's right. Thank you.
That's all right. Just a quick one. I won't hold us on too long. Somebody turns up to a vaccination centre who is potentially COVID-19 asymptomatic or has symptoms and they don't obviously know. Is it safe to have a vaccine if you are COVID-19 positive?
You ask a pertinent question. If you are asymptomatic, you don't know it and I don't know it.
Exactly.
So, and therefore it's bound to happen.
And some people might turn up with a symptom unknowingly, or the symptom develops later that day and it actually turns out they're positive. But is there any negative impact if somebody is basically injected with the vaccine who is COVID-19 positive, but they don't know it at that point?
Yeah, we don't know, because in the trial similar things would have happened. People who've registered for the trial at the very beginning could also have been asymptomatic when they first arrived.
Of course, yeah.
We know of no harm, but that's the only answer I can give you. But the problem we have got is in a disease which is asymptomatic, we really can't. There's no way we are going to be able to, give the numbers we are doing, to test and then vaccinate.
Yeah, of course.
We go on the basis of the absence of fever or absence of dry cough and the presence of smell, and we take it that you don't have classic symptoms.
That's right. So yeah, that's thank you.
And given the prevalence of the disease at the moment in London and the amount of vaccines we are given, it's bound to arise that somebody gets the vaccine who's already is already contracted the disease.
Yeah.
But so if you look at it, the people who are most likely are healthcare workers, because they are actually meeting the vaccine every day at work. But we have been immunizing the healthcare workforce as well, and so far no one has come to any harm from the workforce, and the workforce keeps turning up for the immunization. So I get the feeling there is sufficient confidence there among the healthcare workers that they knowingly walk out of a ward full of people with COVID and queue up to get the injection before they go home, literally.
Yeah, no, that's great. No, thank you.
Thank you, Beck. Thank you, Vasa. Asha.
Thank you, Una, and thank you, Doctor. I've got quite a few questions and I'm conscious of time, and that relates to the work that I've been doing phoning from a GP practice before Christmas and now after Christmas, and the procedures are different. And before Christmas, the GP practice was the main coordinator, but what I find now is that patients are being contacted directly by NHS Direct to go to Epsom or to the Excel Centre. So there is no coordination by the practice. So if you're going to follow up with a second vaccination, it's going to be very difficult for the GP practice to do this. The Epsom Centre is giving the patient both dates for both vaccinations, whereas the GP practice isn't. And there's also an issue concerning the card that's issued to the patient. It hasn't got a name and doesn't have the name of the vaccination other than a batch reference. But I'll put all this in a note to you, Una. If you could pass it on to the doctor, I won't take up the time, precious time here. Is that all right?
Thank you, Asha. And it's very important that what we need is feedback on the ground, like people like you who actually see it as it is, and then we need to feed it up the system, for the system to be aware. And this has been fed up the system, how the GP practice books somebody in, and then they get a letter from race course, and then they got 2 appointments, and they're confused, and then there's wastage. So the question is, because of our desire to target cohort 1 and 2 first, both parties, local and central, are targeting the same cohort. So then I think we got to come to an understanding. Shall one party try 1 and 2, another party try 3 and 4? Maybe a 3 maybe get done before 2, but there'll be less confusion if you target different cohorts. So these are the things we need to think about to solve this problem. But the same person being contacted twice is a waste, and more than a waste, it causes confusion. Totally agree with you. And we need to
I will send you the details, Doctor.
Thank you.
Because I've had lots of exposure, and it's been, as I say, lots of hard work being done by many, but we need to streamline it a little. Thank you.
Thank you very much, and thank you for all your work at practice level too, because we need support. I'll tell you, we definitely need support to get group up to group 4 done in the next 4 weeks.
Well, I enjoy that most.
Thank you. Thank you.
Thank you, Asha. And yes, please do send that email and I'll forward it on. And if anyone has any other questions as well outside of this meeting, please do email them to me. I think we have time for just one more question if anyone has one. Karen, I see you said, is the vaccination given recorded at registration?
Yeah, it was really connected to what Asha said. So they get that card, and I agree with you, it's all but they go through a registration process at the hub, and I have filled in the kind of personal details. So something is going on their medical record through the NHS data system. Doctor, is it saying which vaccine they've had?
Yes, so that is what people call the pinnacle. You may have heard this word pinnacle being used. So that's a special data system which is recording the COVID immunization. So in that it will say your name, your NHS number, and which agent you were given and the date.
Fantastic.
And that is going to be the way we are going to find out who needs to be called back and what they need to be given, which version of the vaccine need to be given. So that's our basis. Yeah,
that's really good to know. The final thing, the post is rubbish at the moment. I haven't received things for weeks. And is there any problem about sending out all these letters, to get people to come for vaccination?
At practice level, we don't do letters, we do phone calls. At the national level, from the race course, that is the cohort which gets the letters. And I personally think that the phone call is really important, because you have a discussion and you can clarify issues, and you can also find out about certain things like warfarin and stuff like that. We can find out about recent checks and stuff, and also clarify about what do you mean by an allergy and what was that allergy about. And some people will say, I was 8, I'm 80 now, that happened when I was 8. And you really have to go and dig into the notes to find out what that is about. So I'm a fan of the phone call method, if possible.
Doctor, there's another route which is going online onto the website and booking. So they've got a letter, they've got an online facility, and the GP practice. I'll write all this down because I've been facing this in the past 3 weeks. So thank you.
Thank you, Asha. When we come to once we start going down the age cohorts, they're not going to wait for my phone call. I know that. And now I think there's an issue now where the phone calls are really important. But as we progress, the phone calls will become less important.
Absolutely. Yeah, you're right. Thank you.
So my message to you is that don't underestimate your importance for the system, because it is not an overstatement to say that we are at a very serious point in the nation's history. It's not an overstatement. I don't want to sound like Churchill, but actually we are in medical terms, we are at Dunkirk now. Simple as that. How we consolidate, how we react to this will define us as a nation. And I therefore really is a plea from me. You have to talk to people and you have to explain things, seek their concerns, no labeling, no judgment, total understanding, total grace, total compassion. We really need to go by core values of humanity here and try and get people to understand why, as much as I mask for you and you mask for me. Similarly, it comes back to this question about vaccination. You're doing it as part of a social contract for each other, that we want to make sure that the system functions, because it's not only about COVID. There's more to life than COVID. It's about economy, it's about jobs, it's about children going to school, it's about the next generation having reasonable education, reasonable employment, it's about heart attacks, it's about strokes, it's about cancer. This much wider picture. And believe me, history will judge us. What did our generation do at the hour of need? And the hour of need is more champions going out into the community so that we get the numbers up, we sort this out, and we get out of this.
Thank you, Vasa. Couldn't have said it any better. So thank you for giving up your evening and speaking with us, as well as Kieran. Thank you very much. It's much appreciated. Thank you, champions, for coming along as well and contributing as valuably as you do, and all your questions as well, which we will share with you on Friday. So that, yeah, in our next steps, we'll continue to use your questions and feedback. Our next session is on the 20th of January, the same times between 12 and 1 and 7 to 8. Our theme next week is the review of our approach. If anyone would like to see anything in particular being discussed over the next few weeks, please do let me know. Send me an email and we can plan out the next few weeks' workshop themes. We ask that you spread the key messages to your networks. Importantly, today, the messages around the vaccine. If you do have any other questions in the meantime, please do send me an email and we'll share them with Vasa and Kieran and get answers for you. If you know of anyone who would like to join the Champions Network, please do send them our way. You do great work already. Our numbers continue to increase every week. So thank you, everyone. And thank you all for sharing the key messages. And please do continue to do so. Have a good evening, everyone. Thank you all.